Hi there, this is Dr. John from the Florida Center for Hormones and Wellness. And I wanted to just chat with you briefly about a question that I hear almost every day in the office, if not several times a week. It's why doesn't my doctor understand hormones, or why doesn't my doctor do this? Well, it's a great question, but I kind of look at that as like why any everyday doctor doesn't do brain surgery, why everyday doctors don't do orthopedic surgery. Hormone therapy can be a very specialized, very individual area of medicine that takes specialty training and a wide understanding of the complexities of the hormone or endocrine system. And it takes a lot of extra training. Myself, for example, I will read or look at least 200 or 300 articles a year on hormones. And over the course of time, that builds a body of knowledge and understanding of the intricacies of hormone therapy. Now, family doctors and internists and everyday doctors, they're fantastic people, and they do a great job at what they do, that is taking care of everyday problems like the cold and the flu and diabetes and high blood pressure and on and things like that. And they spend a lot of their time studying and reading about these everyday problems, and I commend them for that, and they do a great job. But when it comes to the complexities of hormones, it takes a lot of understanding of the intricacies. Not only that, as many doctors have been exposed to some of the old understandings of hormones, particularly the synthetics. And while it's very true that the synthetics caused a lot of problems, that's been spread over or spilled over into the concept or the idea of the natural or the biologically identical hormones. It's been what I call conflated or mixed or stirred together. So what they might have heard about some of the synthetic hormones is spilled over and gotten confused with what goes on with the biologically identical. And in their mind, with the family doctors or the internist or a number of different doctors, they're all one and the same. The fact of the matter is that the literature is very strong in its explicit differentiation between the biologically identical and the non-biologically identical hormones, in that the bioidentical hormones are safe and effective when done by people who understand how to use them and use them effectively. And it takes a lot of reading, a lot of understanding, and a lot of work to really become clear on those differences. I myself, for example, I have a master's degree in nutritional and metabolic medicine, and I've taken hundreds of hours of additional study and understanding the intricacies of hormones. And by doing that, I can look at the literature and understand the literature in a slightly different way than the everyday doctors do. And that's no knock on them. They're good at what they do and the things that they do. It's just that I understand these things, and doctors like me understand these things a little bit more clearly and are able to safely apply these principles to the everyday treatment of people. It's kind of like this. If you went to a neurosurgeon and God forbid you should have some type of an abnormality in your brain or a tumor that needed to be worked on, and you went to your family doctor and the family doctor said, "Oh no, I wouldn't do that." I mean, who would you believe in that instance? Obviously, the neurosurgeon who has hundreds and thousands of hours of extra training and surgery and the understanding of tumors, you'd listen to his advice. The same thing kind of holds true for a hormone expert. A hormone expert may have hundreds and in fact thousands of hours of extra training just understanding hormones. So when you have to weigh the advice of a hormone expert versus an expert in everyday medicine, you have to make sure you're making that differentiation and allow your decision-making process to take those two differentiating factors into consideration. So this is Dr. John discussing why traditional doctors or everyday doctors may not approach or understand or recommend hormone therapy the same way that a hormone expert might. Dr. John from the Florida Center for Hormones and Wellness.